Hello, Tri-City. This is Dr. Preeti Sharma, Consultant Pulmonology, Critical Care and Sleep Disorders at Gratian Super Speciality Hospital, Sector 69, Mohali. And you're listening to me on 94.3 My FM. Jio Dil Se.
Right. Dr. Preeti, first of all, I would like to ask about asthma. And people have lots of stigma regarding the use of inhalers. So, कैसे पता चलता है कि हमें asthma है? क्या कहेंगी आप इसके बारे में?
See, asthma is a very common disorder which is being found in about 20 million people in our country.
20
and
million,
about and about 2 lakh deaths occur because of asthma. So it's a chronic inflammatory disease of the airways. Usually people have a chronic cough which is very persistent in nature. You keep going to different doctors, you keep changing your medications, but your cough doesn't go. You do not think about other problems. You need to have a chest specialist consultation for your chronic persistent cough. Other symptoms like you can have chest congestions multiple times. You are having chest infections multiple times. You are having a wheezing sound, that is kind of a whistling sound while you are breathing in, especially in the kids. And then you have breathlessness, even at work, even while you're exercising, you may have breathlessness. So these symptoms come and go and you don't bother sometimes. But whenever you have such kind of symptoms, you should always consult your chest specialist so that you can get investigated, and by a very simple test called as lung function test, we can diagnose asthma. And hence, we can start the treatment once you're diagnosed with asthma.
And treatment, you mean to say the inhalers?
Yeah, there are a lot of treatments. We start with inhalers, and I don't know why there is a stigmata about the inhalers, like diabetes, hypertension. Asthma is a disease. We take medications for diabetes, for hypertension. Every day we take tablets. For asthma, we need to just have an inhaler, which does not have so much of side effects as people think about. So you need to control your asthma, which can be done only with inhalers. Without that, there is no medication, no oral medication which can help you in asthma. So inhalers are the integral part of the treatment of asthma.
And if I talk about vaccinations, how vaccinations help in asthma?
Yeah, vaccinations have an important role. See, these patients of asthma and COPD, they have a chronic health lung conditions. So they are immune to get infections very easily. Even the elderly, diabetics, and any patients with a kidney disease. So these patients, in case they have a seasonal flu, which all of us mostly have, but rest of the people will get good treatment and will get better soon. But these patients, they will not get better soon. They'll get worse of these seasonal flus. They'll turn into pneumonias. So these pneumonias, if left untreated, can lead to high mortality also. So for that matter, we need to give them vaccinations, which is like influenza vaccination, which is readily available in all parts of the country. And in our hospital also, we give them influenza vaccinations annually. So these vaccinations will prevent them for such a fatal infections basically. So that is important for these people.
All right, since you are here, and let's talk about one very common thing, which is, cold हो गया, sneezing हो गई, ये तो है ही, but snoring. इसमें बंदे को नहीं पता चलता, लेकिन जिसके साथ वो सो रहा होता है या आसपास के लोग होते हैं, यार तू खराटे बहुत मारता है. तो I want to know, is snoring is normal or it's a disease?
See, in every other house you will see a person who snores, and we usually make a fun out of it. But it is not exactly that. It's a problem which should be taken into account. Sometimes people snore after they are really tired or they had alcohol or sedatives. That is because of the relaxation of the muscles. But the habitual snorers, they are really important people who should be taken care of. We need to investigate them for a disease which is called as obstructive sleep apnea. So what happens is, for a few seconds, about 10 to 20 seconds, our airflow ceases. That is, there is no inflow inside and no airflow out. So we have stopped that breath for a while, which we don't come to know. And this happens about 100 times during the night time if patient has an OSA. So this will lead to disturbance of his all life routine. You will be sleepy during the day, at your workplace. You can even doze off while driving if it is a severe OSA. So it's really risky to life. OSA is also associated with diabetes, hypertension, stroke, even heart attacks. So it's not a simple problem, but it should be treated and it should be recognized first of all. You should always have a sleep study test done to diagnose OSA and then get the treatment for which we give a positive airway pressure. So at our hospital also we do all these sleep studies, diagnose people and put them on CPAP machines, and they really have a good lifestyles after that. There's a real modification of the lifestyle.
Is this a problem of lifestyle also?
Yeah, it is. In case we don't follow, we have junk food every time, we don't follow our diet routines, obviously this will increase. So we need to change our lifestyles, our weight reduction programs, as well as the positive air
So you
pressure.
mean to say exercise, yoga, and all these
Again, that
things?
will also help it.
I see.
It depends on the degree of the obstructive sleep apnea. So there is an index AHI. So if it goes high, so it will become severe. So that is the problem.
And Dr. Preeti, what is your message to all the people who are listening to you right now?
So I would always tell my people to consult your chest specialist whenever you have all such problems. Moreover, we are organizing a camp on sectors 37C Gurdwara, Singh Sahib Gurdwara, on 14th of April from 10 to 2, where we have free chest consultations,
I see.
and we also be doing this spirometry test there to diagnose these kind of diseases. You're all welcome there.
Of course, ये इट्स अ वेरी कॉमन प्रॉब्लम, बहुत देखी जाती है एंड कई बार लोगों को नहीं पता होता इसके बारे में. तो आई एम श्योर आज ये सुन के कई लोगों को पता चला होगा. डॉक्टर प्रीति, थैंक यू फॉर बीइंग विद अस. थैंक यू ऑन 94.3 बाय एफएम.